I call it a pandemic of men who are getting these women pregnant and disappear afterwards. Home birthing is free of cost once it is being done by a midwife that is employed to the government of Jamaica.
When I look on TikTok before having my baby, I saw a lot of home remedies. Curb walking, time tea, drink one whole bottle of olive oil. What is that red tea called? I don't know if you remember. All type of things. What are your thoughts on these things?
So,
Hi, mamas and friends. Welcome to this episode of Memories and Motherhood. I'm Whitney, your favorite baby photographer and host, and we have so much to talk about today. Before we begin, I just want to say that this episode is brought to you by Little Memories JA, where little moments last forever. From maternity to newborn to birthdays and everything in between, we're here to capture the moments that matter the most. Our guest for today is a midwife par excellence. Midwife Cooper-Bernard will be joining us on the Memories and Motherhood couch today. So whether you're a mama in the making, a pro at this, or you're someone who loves just a good baby hack, get comfy and join us on this episode of Memories and Motherhood. But before we begin, I'm reminding you to subscribe, share, follow, and remember, this episode is brought to you by Little Memories JA. Let's dive in. She's not your regular midwife. She's a midwife par excellence with over 350 births to date. She is a Governor General awardee for excellence as well. One of the best midwives, if I may say so myself, in St. James. Welcome to the Memories and Motherhood podcast, Midwife Cooper-Bernard. How are you doing today?
I am blessed and highly favored. Thank you.
It's so nice to have you.
It's my pleasure to be here.
Tell us a little bit about where you practice and how long you've been a midwife.
All right, so I've been a midwife since 2016. Yes, started at the Cornwall Regional Hospital, where I'm still a sessional midwife. However, I am now based in the primary health care, which is a health center at the Granville and Tower Hill Health Center for the past 6 years.
What is the experience like on a day-to-day?
The experience is very good. Knowing that you would have met a woman, met the family, and been in the community, because of course the midwife has many roles, and bring this woman through pregnancy, delivered her most of the times, and then to see her postnatally, both mommy and baby. There are sad moments where mommy is here, baby didn't make it, but to be here for her through the tough times and through the happy times, it is quite fulfilling.
Awesome. Now, we're going to be talking about pregnancy, preparing for delivery, and then the delivery itself. So let's start off with pregnancy. What are some of the most common telltale signs that, hey, I'm pregnant?
The first thing is a missed period. Yes? Who wants to miss their period when they're not ready for a pregnancy? It gives you nightmares, it gives you anxiety and everything. So the first thing is a missed period. However, for those who do not have a regular cycle, they would start having cravings, start having side effects, the vomiting, nausea, all of that. And then they would go and get tested, and that's when the confirmation comes.
So definitely missing a period.
Missing a period, and then you have the symptoms coming in.
So what about the most common symptom that a lot of women complain about, which is morning sickness? What are some tips that could be, that a woman could use in order to get rid of or to alleviate morning sickness?
All right, so being a woman who went through this both pregnancies for the entire long haul, didn't get a break. And so I would say there were some things that I had to learn along the way. Small, frequent portions. I would tell a lady, don't try to eat like everybody else.
Right.
Eating small, the smallest plate in the house should be your plate. And when you finish that and you feel for more, you can go back, Eating a small amount, that might come up and then give it a few minutes.
Yes.
Go again, and that will stay down. So you had to develop a pattern. Avoid greasy foods, spicy foods, highly sugary foods. Avoid laying flat. Right? So you prop yourself up a bit, almost in a sitting position. Go and see your obstetrician gynecologist, speak to your midwives, and get something for it.
All right. So let's talk about prenatal visits. How often are they done, and what happens during a prenatal visit?
All right, so prenatal visits, or otherwise called booking visits. This is where we get to know a little bit about the client, and the client gets to know about us, and we plan the care so that we can have a successful pregnancy, labor and delivery process, right? Now, we see the mother from inception of pregnancy up to 28 weeks every 4 weeks. 28 weeks to 36 weeks every 2 weeks. And then 36 weeks up until delivery, it's every week. What takes place? Once the client comes in, we would have asked them to bring some documents when they're coming back from booking clinic. Now, when they come in, we do an interview, we do counseling where they are counseled on HIV, different sexually transmitted infections, and how it can affect the pregnancy, how to stay safe. Of course, we do blood tests, checking for HIV, syphilis, sickle cell status, etc. Right? And that will set precedents for the blood results for the client. We also do counseling. We do educational session, which it turns out to be very, very, very good for the clients, because you're coming in, you want information, you don't know much, right? And they come in, they get their educational sessions. Every clinic visit, there's something new or a reminder that is taking place.
What exactly do they learn during these educational sessions?
All right, so they learn everything that there is to learn about themselves, the pregnancy on a whole, danger signals, the different medical conditions, hypertension, diabetes, preeclampsia. Everything there is learn how to shop, what to shop for, what should be in the bag for mommy, baby, breast pump, all those things that they wouldn't even have thought about.
Right.
They learn about depression also, because you have postpartum blues, you have postpartum depression, you have postpartum psychosis, what to look for, when to act, all of that. And we do also encourage the spouses to come. So bonding takes place and they can help in that regard as well.
So you're talking about the experience of going to a public clinic for antenatal care. And this is before the baby comes. So what is the difference between going to a public clinic versus going to a doctor for antenatal care?
It really is up to the person. I realize that the major reason why a lot of persons go privately is because of the time. Unfortunately, some workplaces do not see pregnancy as something that you would ensure that the client partakes in to ensure that themselves and their baby are healthy.
Right.
And so time is not really allotted for them to go for antenatal care, maybe getting a few hours off or getting the day off. And so persons will opt to go privately because of that. I have been told by the clients that they choose to come to the health center because the education is there, right? So it might be a little lengthy, but when they leave feeling aware and assured and feeling, confident that they can manage postnatally even during the pregnancy and beyond.
So the benefit then is that education is widely available in the public clinics versus going to private doctor.
That is what I've been told. That also the thoroughness of it.
Okay.
Yes.
And that sounds good. Now, which foods should be completely avoided or maybe reduced while a woman is pregnant?
Well, for me, I say moderation, because every food has its nutritive value that adds to the woman. I would say do not overindulge in things like maybe kidney, liver, even though it has a high iron content, you still have to think about the vitamin A aspect of it, which too much of it can cause a problem for the pregnancy. You want to ensure that you are avoiding certain foods when you're going to take your vitamins. For example, your iron supplements. You want to avoid anything with dairy 2 hours before and 2 hours after, because what it does, it inhibits the absorption of iron in your body, whereas if you were going to have your iron supplements, you would want to maybe have something with vitamin C, which enhances absorption of
Better
iron
some
in your
people
body.
don't know.
A lot of persons don't know that. And so, yes, they're taking their vitamins, they're having their iron-rich meals, they're doing what they need to do, but they're having it with the wrong things. Yes. So, things like that. But I wouldn't say cut everything or cut totally, but know when, how, why, and where.
So, what are your views on birth plans? Are they important?
Yes, I think so.
Why?
Because you're more aware of what you want. You know, your midwife knows how to meet you. You know, your obstetrician knows how to meet you. And I find that women who have their birth plans have a more, what would they say, successful pregnancy because they already know what they want as opposed to just be free flowing around. They are assertive, they know what they want. And these persons tend to get the information that they need also.
So, how can a woman reduce the fear and anxiety? I mean, you get to the point where you can prepare a birth plan, but then mentally, it may be very nerve-wracking to even think about the fact that I'm about to push out a whole baby.
You know what? The first thing I tell my clients, because I am aware of that, don't listen to the naysayers.
True.
Second thing I will tell them, not everybody will have the same labor. Not everybody will have the same pregnancy. Not everybody will have the same of anything. So go into it. The fear of the unknown is what is happening. And so somebody who has done it before, I feel as if they are capable of advising me and I'm supposed to listen. You listen, but you don't internalize what you hear. Right? So you speak to your midwives, speak to your OBGYNs, and speak to persons who not drive fear into you, but encourage you. I find that works.
That is important.
Yes.
So, we're talking about getting over the fear, but now let's talk about how to prepare for the big day.
Yes.
What should be packed in a hospital bag?
So, do not overpack.
First thing.
That's the first thing. Don't overpack like you're packing for a week in the hospital. You pack for your spontaneous vaginal delivery. However, we know that pregnancy, labor, and delivery is unpredictable.
Yes.
And so you pack for 3 days.
Just in case.
Just in case you do a cesarean section. And then if you need anything, you can always send for it and your visitors can bring it to you.
Right.
So you want to pack stuff for the mommy. Her night gowns, and ensure that the night gowns are able to breastfeed.
So things with buttons
Things with low front or bottom front that can help with the breastfeeding and not a struggle. Underwears, sanitary napkins, slipped or tights. Yes, so we don't want to see the underwears coming through the night gowns.
Alright.
That's not really, pleasing to the eyes. Yes.
You have to think about
Also,
being in a public facility
yes.
that people will be around you.
And we have male doctors, we have registrar who's male.
Yes.
You know, we have visitors on the ward who come in and they're male, and so you really want to keep it at a, respectable level. Also for the baby, you want to ensure that you have hats, socks, because they lose heat easily from the entrances, diapers, towels, olive oil. You want your alcohol and your white alcohol and cotton to clean the navel. Yes. And anything else that you think would be necessary. You must have your antenatal book with you. That is like your passport. Yes. Also, you need to have a girl name, boy name. Remember we said that ultrasound is not always 100% correct, so that is very important. And you bring your birth paper, $200 or so to register the baby. If you're married, the woman, once you have the marriage certificate, you can register the baby for both you and your husband and such the like. And also, never forget clothing to go back home.
For the baby and
For
the mom.
For mommy.
Right, because I remember you said that you cannot let out a mom in her
No, we
90s.
don't.
So she has to be decently attired to exit
yes.
the hospital.
Yes.
Tell us about the clothing type for babies now. Because when we're packing for a baby in the hospital, what are some colors that we should avoid?
Red and yellow.
Why is that?
Red, remember that we would have clamped and cut the umbilical cord. The baby does have orifices, mainly the vaginal orifice or the penis, right? The anus. And baby can be bleeding from those areas. Baby has on red clothing. It is not until baby would have lost a lot of blood that you will realize that baby is bleeding.
Right.
You know, so you try to opt for observation purposes in the hospital and also for yellow clothing. Baby has a light shade at birth. You put the yellow clothing on. Of course, baby's gonna now have a yellow shade. It now puts up a radar to rule out for query jaundice when there really isn't. And if baby is jaundiced, it makes it more enhanced. And so for the observation period, we say leave the colors out that will affect the observation of the midwives on the ward for the baby. Right?
So definitely avoid red and
Red, brown, black, those colors that will hide bleeding.
Okay.
Yes.
Now, when I look on TikTok before having my baby, I saw a lot of home remedies. Curb walking, time tea, drink one whole bottle of olive oil. What is that red tea called? I don't even remember. All type of things. What are your thoughts on these things?
No.
Just no.
No. Leave it alone. I say baby has to come out.
Mm-hmm.
Yes. Whether you want it now or not, whenever the pregnancy is ready to be terminated, it will happen.
Yes.
One way or the other. One of the major one is the time tea.
Mm-hmm.
And so, yes, it does expedite delivery. So, contractions are coming on rapidly and baby out and you're like, whew, thank you. But remember, because that uterus was contracting so much before delivery, after, for your third stage of labor to occur, that uterus is so tired, it refuses to contract. It's now relaxed and gone on vacation. What happens? The woman hemorrhages.
Because
And
the time tea is still working even after the delivery.
Still working, but the uterus is not responding.
Oh.
So the uterus is supposed to contract to get the baby out. It's also supposed to start contracting again to stop the bleeding after delivery, but that is not happening. The uterus has stopped working because it is so tired from
Yes,
that amount of work before that the oxytocin would have caused. And so many of these women, we have to rush them to the theater to try to stop the bleeding, and some of them end up losing their uteruses because that's the only way we could have stopped the bleeding.
So definitely avoid the TikTok remedies.
Avoid TikTok remedies, yes.
No, when I was ready to have my baby, I didn't know what contractions were like. And so I read about Braxton Hicks versus real contractions. What's the real difference between both of them?
All right, so I normally encourage my clients, once you start having any discomfort, head for your timer.
Okay.
If you're able to track it every 15 minutes, every 10 minutes, you can almost know one is coming. That is definitely you are in labor. But if it comes maybe at 3 o'clock, you don't feel it again until 8 o'clock in the night, and then it's all over the place and you're not able to track it. That is Braxton Hicks, known as false labor.
Yes.
All right.
All right. Now, what is the process of signing up for a home birth? So, when a woman is giving birth in Jamaica, first of all, what are the options that exist?
So you have the hospital, you have home birthing, you can have your delivery at a private facility.
And how do you sign up for a home birth?
Home birthing, well, it's quite a long list. The criteria is quite long, yes. But can I tell you that initially, the ideal or what is supposed to happen is that home birth is the first option. Yes.
Meaning like from long time or?
Since the inception of registered midwives being licensed by the Nursing Council of Jamaica. So the midwives were trained, placed in the various communities at each health center to deliver the women with their normal spontaneous vaginal delivery. So the only women who should really be going to the hospital for delivery are the women who are high risk. Yes, but it has somewhat
changed
since then. A lot of persons I'm finding out really don't know about home birthing, but home birthing is free of cost once it is being done by a midwife that is employed to the government of Jamaica. Yes. The client will come in. We will have a one-on-one. We will determine if the client is eligible in terms of no high-risk conditions, high blood pressure, previous surgery, anything that can pose a threat to the mother, baby, or the midwives at the delivery. Also, it cannot be her first child, cannot be number 6 and above. So the second, the third, the fourth, and the fifth.
Right.
Once all conditions are right, yes, you can do a home birthing. The midwife will do all the necessary steps, the blood tests, all of that to ensure that all is well. A final ultrasound is done about 36, 37 weeks in preparation for delivery. And then a home assessment is done. So the midwife comes to the home 2 weeks prior to delivery to know where the woman lives, to assess that all is well, electricity, water, the seed is safe, etc. And then the birthing is planned for.
So what about water births? Are those possible?
It is possible, but we have not yet been trained, and so as per protocol, we must be trained before we do. We hope that one day we will soon. We have been asking for it, and so
Fingers
hopefully,
crossed.
yes, fingers crossed.
Now, how can the woman know when she is in fact in labor?
There are 3 confirmative signs of labor. So not the feeling for ice cream, not the cleaning the house, not the washing for everybody, not all of that. Those are presumptive signs of labor.
Right.
But the confirmative signs we spoke about contractions earlier. So they're timeable, they're regular, they're rhythmic, right? And also water breaks. So the whole place underwater, you know you're not peeing on yourself. Yes, that's another sign. And the third one is a little bit of blood and mucus mixed together, and we call that the show.
Right.
So any of the 3, you know definitely that something is happening.
So when I see any of those 3 signs, what happens next?
All right, so we normally encourage the mothers, if the water breaks and you're not having any of the other 2, or you're having the other 2, or even if the water breaks and there's nothing else happening, you must go to the hospital now. If the water is still intact, right, and you're seeing any of the other 2, you can observe, because you don't want to run off when you're feeling to cramps and stuff. You want to go when the pain becomes unbearable or you're having pressure down in the vagina, because I can let you know that not every woman has labor pains.
That's true.
Yes. Right? And so we tell them, some persons, we don't want them to be just waiting on the strong contractions. If you're having pressure in the vagina without those strong contractions, go and get assessed.
So we talk about the signs. Now, what are the stages that the woman is gonna go through while labor is happening? What are the stages of labor?
All right, so you have 4 stages of labor. Yes, first stage of labor, from cervix opening up to 10 centimeters. Once you get to 10 centimeters, you're noted to be second stage of labor. When the baby comes out, placenta and membranes are now ready to come out, she's now at the 3rd stage of labor. And then up to 1 hour after all of that has been done, the woman has been stabilized and everything, and she's now in the recuperative phase, then we call that the 4th stage of labor.
No, nurse, I didn't know until I had my baby that I didn't have to push out the placenta. I feel like that was, I didn't know that. Of course, there are stages of labor, but I thought that all I had to do was push and then push again.
No.
Now, clear up the air on that.
All right, so you delivered your baby. Once the baby is out, it's my time to work. All right, so we would have given you an injection on the leg, and that is oxytocin, and that is supposed to help with the release of the placenta from the uterine wall. I am supposed to do all of that. Most times it actually comes out on its own. You have up to 1 hour after you deliver for that to be delivered. So it's not a process that we rush. Your baby will be placed on your breast, bonding begins, and all of that process will help also with the expulsion of the placenta and the membrane. So that is up to me.
As the midwife.
As the midwife. So we normally tell our clients, your job is done. It is now my time to do the rest.
Now, let's backtrack a little to a home birth. Is it the same stages of labor, the same process, everything that happens during a home birth that happens in the hospital? Is there any difference that exists between both?
Yes, there is.
Tell us about that.
Just the peace of mind, the comfort of being around persons who you want to be around. When you're in the hospital, it is you in that room, your midwives, your doctors that will come around from time to time. However, when you're at home, you have your spouse, your children, you get to choose who is in that room with you. You know, just the thought of you being in the comfort of your home, I find that it allows for smoother progression of labor. The mothers are less violent, are less aggressive, you know, less boisterous. The labor process is smoother. And, you know, even progression. The spouse is there, you know, they're having their little affectionate moment and all of that. So the natural body fluids and everything will be flowing, and that tends to help with the process. Everything that is done at the hospital is done at home. We do insert our IV abscesses, fluids, medication if necessary. She does get her hourly checks, blood pressure, fetal heart, vaginal examinations as necessary. Everything is done as if she is in the hospital. You know, and after delivery, we bathe the baby, the woman is tidied, she gets her tea, her dinner, everything in bed. The midwife visits you day 1 after delivery, day 3, day 6, up to day 9, you get your home visits. You know, and so your preliminary birth paper is given to you at home. The baby's immunization record is given to you at home. It's a totally different process.
And that is for a home
That
birth.
is for a home
But
birth.
nurse, what happens if there's an emergency during a home birth?
The same thing that happens if there's an emergency on the ward. Of course, you know that you would have been monitored all this time, and so any deviation from the normal, most if not all midwives are mobile people. So the vehicle is always outside. We make our contact with the hospital, and you're at the hospital within a few minutes. Whatever process needs to be done is done, and mommy and baby are fine. We have never, I cannot recall a sad story on a home birth.
And
I
you've
can
done
tell.
a lot.
And I have done quite a bit.
And that's impressive. But one of the things a lot of people ask, what about having a partner at the hospital? Why are we not allowed that privilege, I guess, in Jamaica?
It used to be. I can tell you, it used to be. For one of the main reasons, you know, the whole thing happening with the hospital, the whole movement where they are now, it's impossible to have a spouse there. It's a smaller space. So it is my hope that when all becomes well,
Again.
it will happen. Because there used to be private rooms at the major hospital, yes, there was.
So we hope that eventually that will come back. Because I mean the government is talking about, oh, the birth rate is declining, and what are your thoughts on that? Because come on, we're in 2025 and the economy is totally different from how it was back then. What are your thoughts on that? Why do you think that I wouldn't say nobody, but why do you think that the birth rate is declining compared to back then?
You know, it's as if you're in my head. Because it was yesterday I was having that conversation with our father that came with his spouse to 6-day clinic, and we encourage that. One of the major reasons, and nobody's talking about it, is the availability of the spouses. I call it a pandemic of men who are getting these women pregnant and disappear afterwards. I call it a pandemic of men who are getting these women pregnant and to say they are not ready or they don't want a baby. No, they're giving them money or offering them the money to go and do a termination. And because the woman does not want to do a termination, she's now on her own because she's the only one that wants that child. And so many other reasons. So aside from economics, there are so many. I think there needs to be a campaign. I think there needs to be something. Somebody coming up with a plan to educate and to encourage the men to stick and stay. So if I make the mistake, if you want to put it as a mistake, and have one child for you, it's not going to happen again.
Yeah.
And if another man comes into my life, I might not want to even try to see if he will be a better father. So that is, I think that is 70% out of 100 of the reason why women are opting not to go again.
So definitely women are becoming way wiser and women are not buying no pussy in a bag anymore.
Amen, amen, amen.
And that is such a vital point because as you talk about support, a lot of women, and for me, one of the biggest factors was having my husband there. I needed him to see that this is how a woman delivers, this is how a woman gives birth. I think it definitely deepened his appreciation for the process. And more as he look at me every day, would I say, you know, like, you're really strong to go through that, because I don't even know how I went through all of that.
Have you ever seen them in the labor room? They pass out very often. They cannot. They cannot. And so we need to start having campaigns just encouraging the men. Even if you're not ready for a child,
Yes.
co-parent,
Stick and stay, as you say.
support, you know, because it is affecting us.
That is
I
so
encourage the women to make better choices. Make better choices. Some of us, we see the red flags and we still go there.
true. Mhm.
Yes.
So let us go into the process of pain management. How does a woman help to manage her pain? Or what are the options of pain management during the delivery process?
All right, so we do have pethidine, yes, which
What's
does
that?
work wonderfully. It's a pain medication that can be administered during labor process, but up to a particular centimeter,
Okay.
right? So when the woman gets to 3-4 centimeters, she can no longer get that medication because yes, it will help with the pain. But when she becomes fully dilated and it's time for her to deliver her baby, she's fast asleep. So it's an after effect of that medication, and so you want to avoid that. Now, there are other things doctor will decide to prescribe or so on, but for the woman to assist herself in the process, I would say try to remain as calm as possible.
And that is so important.
Try to remain as calm as possible. Do not get frustrated. Breathe in through your nostril, out through your mouth. Do not hyperventilate. Have something. Do diversional therapy. Sing, dance, walk around. Do your squats when the pain comes. I find get a rag, bite on it. Do something. Clap. Do something. Pray. I've heard some Sister Brown and some Sister Clark in the labor room. Trust me. Do things like that that will help, and I find that it gets them through.
Definitely. So those are a lot of tips you just give out, you know. So we don't want to breeze through them too fast, because one of the main things that my midwife told me to do is that every time you feel a contraction, squat with the contraction.
Yes.
How important is movement during labor? Because when I was like staying still on the bed, that was not working out. How important is movement?
It is very important because it helps with the descent of the baby.
Okay.
When you lie down too much, what is there to push that baby down? Gravity.
Mhm.
So gravity helps. So when the pain comes on, the body naturally is pushing that baby down. So when you squat, it opens up the pelvis to get that baby into where it should be, and the progression takes place. So we encourage the mothers, walk around. That is gonna help the process, right? So while it's diverting your attention from the pain, it's like you're on a mission, as opposed to lying down and just swallowing in pain and suffering.
But nurse, follow up to that now.
Yes.
If I have to move in order to get the baby down, why I can't be in a squatting position to deliver the baby?
You know, this has been a long-standing issue. And for me, all right, you see, it would be good if we can approach every delivery that way. So the woman delivers on her fours, however she wants to deliver. But when you look at some clients that you have, you cannot make that mistake. Because you will have a baby who will maybe have birth injuries and other things.
Right.
I have seen women deliver, and upon getting to 10 centimeters, she decides that she's not going to push that baby out. And she tells us there's nothing you can do to get me to push this baby out.
At 10 centimeters.
At 10 centimeters just to finish the job. And she tells me, you cannot let me push this baby out. You have to call me.
So what you doing in one instance like
In
that?
a case like this, you have to just do what you have to do. You call the doctor. Doctor, you know, after talking to her and all of that, sometimes the baby does come on its own and she had no choice. Because you have deliveries where the baby does come out. So sometimes that's what happens. Or you get her to a point where she'll say, okay, fine, I'll try. You know, and it all depends, as I said, the support that she has during labor. Because if she's frustrated and just cannot be bothered, you will get a client like that. That's the end product. She will just give up and say that's it. But if you have a midwife who is there encouraging her, rubbing her back, giving her ice chips, stuff like that, to get her into that position where she feels strong enough to just finish the job. Most times it does happen. But what I'm trying to say is imagine a client squatting who decides that they're not.
Yeah.
You have a few minutes to get that baby out of that vagina. Right? So it's not gonna be a one size fits all for every client. You can try. But there you might have to abort that mission at some point, depending on the type of client that you have. But yes, I'm on for it. Deliver how you feel comfortable.
But then it may come at a risk.
But then it may come at a risk,
yes,
depending on the client. So it's for the midwife and the client that is in the position at the time to know what options you have and what's the safest option. That's my word.
Well, that's a good point, because further to that, you find that some natural births may end up in a C-section. What are some of the most common reasons that somebody going in for a natural delivery would end up becoming a C-section patient instead?
All right, so for the same reason, fetal bradycardia, baby's heartbeat starts falling for whatever reason. Sometimes the cord is compressed. Naturally just start losing oxygen. We have to rush the mother to the operating theater. You have failure to progress. The pelvis just will not open to accommodate a baby. So some women will go to 8 centimeters, and that's the farthest it will go.
So in instances like this, straight to C-section.
Straight to C-section. And again, I say it all depends on the client that you have, because if you have a client in a squat position at 9-10 centimeters, you might not be able to hear that heartbeat, and maybe things could go downhill so fast. So when you checked her fetal heart at 8 centimeters, it was good. And then by the time she gets to 9.5, 10, baby's heartbeat is on the floor. So you have to know. You have to know, and it all depends on what is happening.
Super important. So now, nurse, baby comes out, right? As you said, you put the baby on the mother, you allow bonding and skin to skin. Let's talk about that a little, and then I want to know what else happens right after the baby comes out.
All right, so woman delivers, baby is shown to her to identify the sex of the baby, right? Bonding allow for delayed cord clamping, all right? So you put the baby to the breast, allow baby to start sucking, mommy and baby hugging, and they're having their little moment. Midwives are observing, doing what they need to do. Then at some point we will decide, okay, clamp and cut the umbilical cord. If it is depending on the type of delivery, if the baby is in jeopardy, that will not happen. You have to just clamp and cut at delivery, identify sex, clamp and cut, and head off to the resuscitator. But in a case where baby is fine, mommy is fine, you allow for bonding. Breastfeeding and all of that, you start doing 3rd stage of labor while she's there bonding with her baby. Clean her up, do all you need to do. If she's for suturing, she does all of that. Baby's taken away, given a bath, right? Mommy is tidied, and then they move over to the postnatal observation section. So, yes.
What support is available for women as it relates to breastfeeding and newborn care?
All right, so once the woman delivers, she's automatically supposed to go to the nearest health center, and every parish does it a little bit different. So in some parishes like St. Anna and other places, the midwife goes to the home to visit the mother after delivery. However, where we are now, the mother is supposed to visit the health center closest to her home 6 days after delivery, herself and her baby. We do a full assessment, head-to-toe assessment, vital signs are checked. We do our educational sessions, and we do our question and answer section. So we try to find out if she's in depression, if she's getting help at home, which is very vital, yes. And we plan the care for her, because this woman will be with us at least for the next 6 years, until that child is 6 years old. And so it's a continuous process. We plan her next visit, which is at 6 weeks, and we do encourage, we tell them we do home visits. We don't charge for home visits, right?
So what you mentioned if she's in good health and everything, what happens if you find out that or you see signs of postpartum depression creeping in?
All right, so we have our mental health officers. Yes, we do have mental health officers, so we refer where necessary based on assessment, and then they will take over from there. Remember that she still comes back to us 6 weeks, 3 months, 6 months with the child, and so on. So continuous care. We're seeing her. We're on the ground with her. Most, if not all, my patients have a contact number for me. So not only are they able to see me and reach out to me at work, but at home also. So if it's in the middle of the night and they have an issue, they can call me. The midwives are on call for 24/7.
Now, for the mom as well, there are some things that can happen in terms of whether there was a tear, an episiotomy, or whether it was the C-section scar. What kind of treatment is given for moms after they would have delivered? And where do they access these treatments?
Okay, so once the woman would have received a laceration or an episiotomy or a cesarean section, follow-up is done. So she's sutured, she's given her antibiotics for the week, she's given her pain medication as per necessary, and whatever else she needs to do. She's encouraged to do her 6 bath at home. She's even shown how to do it. For the women with the cesarean section, they go every week at the hospital for dressings until they are deemed to be okay and not in need of dressings anymore. When the woman comes to 6 days, as I said before, we actually look at the laceration, the sutured laceration or the sutured episiotomy to see healing, to see all of that, and we encourage them, we teach them how to care for the area until when they come to us for 6 weeks, of course, it would have been healed by then, but then we get to see again what it looks like. And by way of doing their pap smear, we will see everything at that point.
I was just about to mention that a pap smear is actually done because then
Yes.
this can be a very uncomfortable process for the woman having just delivered, especially vaginally, 6 weeks prior. So what are some things that you usually do to help your clients become more comfortable, especially during this pap smear that is done?
Psychological support does work. And I normally say to them, you're not the first one to come into my room, you know. And you see the lady that was here before you didn't see her come out crying, you know. And they'll be like, nurse, chuman, and the last person who did it, and you reassure them. So I realized that when you reassure them and they say, all right, nurse, you see if you do well, I'll come back to you, you know. And most times, if not all the times when I'm finished, they don't even know. The first thing to note is to ensure that the client is comfortable, because it's going to be quite an uncomfortable experience for some, right? It is not painful, it is uncomfortable, so there's a difference, right? So you get this woman in a comfortable position, you speak to her, you look at her body frame, and you choose wisely the size of the speculum. Yes, there are different sizes of speculums. So you would look at a woman in a small body frame and look for the largest size speculum, of course, and then I tend to ask them if they received a laceration, if they received an episiotomy, and such the like, so you know how to handle this client, especially if they're a bit anxious and uncomfortable. So it tends to work. I don't have a problem. And my clients repeat their pap smears with me.
That's true. I can attest to my pap smear not being so uncomfortable. But nurse, we want to thank you so much for joining us today. Before we end, we just want to ask you, can you give us a mom hack? It may be one thing that really helped you while you were in your own process of recovery or delivery, or it could be something that you can definitely recommend for every mom to be, or any mom that is already a mom.
Yes, 2 things. It's never a one size fits all in anything at all. And so comparison is the stealer of all joy. So don't look at the internet, don't look at your friend, don't follow what they do. Live your pregnancy, live your labor, live your postnatal phase. Ask a lot of questions, and do not compare yourself or your children with anybody else, because, for example, in this where your child is developing, your sister's child at 1 year old is walking, your child at 1 year old is not walking, and you automatically just think something is wrong with your child. No, your child is developing as your child. Your sister's child is developing as your sister's child
At their own
at their
pace.
own pace. There's no comparison. And so I tell persons, enjoy your children, enjoy the process. They look different every day. They do different things every day. And you'll be fine. And ask for help. Ask for help. There's no shame in asking for help. It's a community that does it.
That is so cute. Thank you so much, nurse. We just want to say that this episode of Memories and Motherhood was brought to you by Little Memories JA. And if you want to capture your own memories, whether it is maternity, newborn, toddler birthdays, just about any moments that matter to you, then you can use the code MAMAMOMENTS10 for 10% off your next photo session. Once again, this was Memories and Motherhood. Thank you so much to Midwife Cooper-Bernard for joining us on the Memories and Motherhood couch today. We really appreciate your expertise, your information and knowledge. And if you ever happen to go to Granville Health Clinic or Montego Bay Cornwall Regional Hospital, then ask for Midwife Cooper-Bernard because she is the best. As her Instagram name says, Midwife par excellence. Thank you so much for joining us on this episode of Memories and Motherhood. Remember, like, subscribe, turn on your post notifications, and share this episode with a mama friend or someone who's part of the village. See you soon.